and welcome to tonight's Facebook Live. Thank you for joining me on this very cold Wednesday evening. Tonight, I would like to discuss with you all things pigmentation. So types of pigmentation, how to identify the different you treat these different types of pigmentation with devices. So if you've joined me, thank you very much here on Instagram and here on Facebook and YouTube. So nice to have you all. So while we wait for a few more people to hop on, my name is Nancy Abdou. I'm the CEO and the founder of the Australian Dermal Laser Institute, where we bring you all sorts of device training, whether it be fat cavitation, radiofrequency, plasma fibroblasting, electrolysis, diathermy, IPL, laser, pico laser. Today I was teaching all about pico lasers. That was very exciting. What else? Electroporation, you name it. If you have a device, then we can teach you all about it, how to maximize your results, or those results, by teaching you how to use the device both on label effectively, and also off label, and in combination with all of your other devices. So a couple things before we start off. The first thing I wanted to say is we have an amazing opportunity with the Zing group. So it's a 3-day event. So some of you may have hopped on and seen Chrissy Alger on either Instagram or Facebook talk about this event. So it's 3 days of sales psychology and basically how to, recession proof your business during this particularly, uncertain and tough time. So it could be a little bit challenging for some of you. So these tickets have include 3 days of either face-to-face workshopping, if you like, on the Gold Coast. So I'll be there. So if you're around, come and say hello. And it also includes a one-on-one session, a coaching session, and 6 weeks of marketing, planning, and business planning, and so forth. So if you want to purchase those tickets, they're only $497. We'll put the link below. Just say, to get that special price, just say that you have purchased, we've referred you on, and you'll get those for only $497, which is amazing. It's $3,000 worth. Now, the other thing is, if you haven't already, Beauty Biz. So if you haven't had a look at either online or the hard copy of Beauty Biz, make sure you go onto page, I think it was page 14, where I wrote an article in the Dermal section about the 3 upcoming trends in our industry. So being one, technology is a huge one, and AI. So what you could do with AI is amazing. So there's information on that. There's some information on consulting or consultations and how they're changing. And there's lots of other ideas in there as well. There's another trend as well, but you'll have to read it to find out. So make sure you have a look at this month's issue of Beauty Biz. So you'll find me in there in the Dermal section. If you have any questions as we go along, please ask away. But let's talk all things pigment. So pigmentation, generally speaking, pigmentation is a result of trauma, right? And there's different types of trauma. So the first thing, generally, when we think of sun damage or pigmentation, we consider the sun. So we go, hey, it's just UV damage. You need to wear SPF and that's it. You're right, but you're not completely 100% across it. If you're telling your clients to be only wearing SPF and that is all they need to inhibit pigmentation, then you might be missing the mark here. Because yes, UV does stimulate those melanocytes, and more so in darker skin types than fairer skin types. So they do activate those and make them basically deposit more melanin granules. But the other thing that we oftentimes overlook in the sun is the heat. So you could be sloughing, or your client could be doing all of that. They could be wearing an SPF, and they wear a hat, and they could be, under a shade. But if it's a 40-degree day, or even a 35-degree day, if it's a really hot day, and they're in that heat, what do you think their melanocytes are going to do? They're going to start firing up and becoming really active and deposit more melanin. So not only is just SPF important, but some type of either tyrosine inhibitor, and it can't be a 5% vitamin C. It has to be, more than 20% or equivalent to 20% L-ascorbic acid. And I do have a preference. L-ascorbic acid is not my favorite type of vitamin C. Tetrahexyl ascorbate is, I feel, one of the best vitamin C's with the least irritation, and it works effectively. It's what we have in our Lumen C. So you'll need some kind of a tyrosinase inhibitor, but not only that, you're going to need some type of other melanogenesis pathway blocker or some other lightener, brightener as well. Vitamin B is a really good one. So niacinamide will stop the transference from melanocyte to keratinocyte. And then there's other lighteners and brighteners such as bearberry extract, paper mulberry extract. We've got licorice root. There's just, arbutin. There's so many out there. So that definitely needs to be part of their skincare routine, along with sunblock, yes, but definitely they need to have something that's going to stop those melanocytes from firing on a hot day. So the other reason we get pigmentation is also through physical trauma, if you will. So if you've got, say, something rubbing constantly on a particular area of your body, so for a really good example is violinists. What typically happens with violinists is because they're constantly leaning their violin on their neck, they end up having a bit of pigmentation. Or if you are wearing underwear that's really tight, you'll find in the crease where your groin is, you have hyperpigmentation. What's another example? Some people who cross their legs day in, day out all the time will find on the backs of their legs there's a bit of pigmentation. Watch everyone uncrossing their legs now. Guys who wear really tight belts will have pigmentation around their waist. So it's that constant pressure, trauma, friction, rubbing, whatever it might be, legs chafing, you'll find you've got pigmentation there, and it's just from that constant, like I said, irritation, inflammation. What else? We've got acne. Acne scarring obviously creates pigmentation, so that's traumatic. Surgical, so after surgery, you'll have a bit of post-inflammatory hyperpigmentation from the actual surgery. Of course, we've got PAH from whether it be a burn or a cut or a graze or some type of traumatic event. Your body will then produce that hyperpigmentation, in particular in the darker Fitzpatrick's. And of course, we have hormonal pigmentation, whether it be melasma or cloasma. So they're all the different types of pigmentation. How do we treat them? We will treat epidermal pigmentation very, very differently to dermal pigmentation, and I'll go through and how to work out what's what and what's the best sort of way to actually treat these different types of pigmentation. And of course we've got birthmarks, right? We're born with pigmentation, but how do you differentiate between sun damage and hormonal pigmentation? PAH is easy because we know and a traumatic event has happened, whether it be a burn or a cut or something, and there's that, pigmentation there. So that's easy to identify. But oftentimes therapists struggle with actually knowing the difference between what is hormonal and what is sun damage, and oftentimes they'll confuse the two, or a client will go out in the sun and they'll go, oh, I've got this pigmentation, so we think it's sun damage. But here's the thing, they're placed differently, we treat them differently, and heat will exacerbate them or will actually affect them differently. So let's have a look at how they're different, why they're different, and why melasma and chloasma appear to begin with. So first of all, we know that chloasma or melasma, so melasma while we're pregnant or while a woman is pregnant, melasma will appear. Chloasma is out of that pregnancy. So with those, most times it is a female who is affected. So 90% of those who develop melasma are females, which means there's a small percentage of men, 10% of men, who can actually have melasma. However, they're placed differently. With women, when they get melasma, typically they will get it on their forehead, along their cheeks, their upper lips, sometimes their nose. With men, I find, yes, they'll get it on their forehead, but they oftentimes get it higher up near their temples, and I've never seen it appear on their upper lip. So it's slightly different, but the thing is they're both symmetrical. So if it appears on one side, generally you can see that it's also on the other side. And the reason it comes about is because there's some kind of imbalance, and generally it's an estrogen and or a progesterone imbalance or sensitivity. So when a female goes on or off birth control, or they fall pregnant, whether they have the baby or not, there's a change in their hormones, so pregnancy, and also to some extent HRT can trigger this melasma. And so we have a hormonal trigger, and then what actually happens is the skin is exposed to some type of trauma. That trauma could be the sun, it could be heat, it could be friction, it could be waxing. All right, I'll come back to that in a second. But generally, the melasma is there, and then there's a trigger. There's some kind of an event that actually makes it come out. All right. Stress is another one. So stress affects your cortisol levels, and in turn, your cortisol levels affect your sex hormones. So high stress could actually bring about melasma or chloasma in that instance, and also to some extent, thyroid issues or thyroid disease could also trigger melasma. Now, like I said earlier, how do you identify? How do we know what's melasma? The first thing is, like I said, it's symmetrical. So if it appears on one side, it appears on the other side. With sun damage, it's not symmetrical. It is on the driver's side if they're mainly the driver, or it's on their passenger side if they're mainly the passenger. But generally with sun damage, it's not evenly placed on both sides. So if I look at someone's skin and I can see on their driver's side, yep, lots of sun damage, but I can also see some pigmentation happening on the other side, then to me that's a hint that that there's actually a hormonal trigger or hormonal melasma underlying there. So that's the first thing, it's symmetrical. The other thing is with melasma, it looks like a map. And I'll show you a picture if I can. I've never shared my screen before, but I'm going to try and share my screen with those of you who are on Facebook. I can't do that on Instagram, sorry. And so with the symmetry, like I said, it's there and it's map-like. So freckles appear like tiny little freckles. Melasma is very patchy. And typically you'll see it like this patchy appearance on the upper lip as well. We know that darker skin types are more prone to melasma, and we also know that sun exposure and heat makes this condition so much more worse. So if heat makes this more worse, makes melasma more worse, can you then treat melasma with heat-based modalities? So whether it be a really intense hot peel, there's a good chance you may make it worse. IPL, we know, is photothermal, so there's a heat element. IPL, you might find the first 6 weeks it looks amazing, and the pigmentation that we can see with the naked eye has improved. However, 6 to 8 weeks later, it actually rebounds and it's worse. So not only does it come up darker, but it actually goes in deeper into our skin as well, into the dermis. So IPL is not a great choice for melasma, and photothermal lasers. So if you're doing laser genesis or radiofrequency or anything that's heat-based, potentially could actually make it worse. So we want to stick to anything to cold or mechanical treatments. So for example, electroporation device, so the Apollo Duet, I'm going to throw that in. The Apollo Duet device has a cold electroporation applicator where you can infuse product into the skin, so inhibitors, lighteners and brighteners, and have it on cold to reduce the inflammation. When you reduce inflammation, you're reducing pigmentation, as well as basically allowing transdermal infusion of those actives. Thank you for that needling and dermapen. I'll come to that, Rose Beauty Hair. So anything heat-based is not going to help. Anything that's cold, we're infusing, calming, soothing will definitely help. And we then also have needling. So needling is mechanical. It's not causing trauma, but what it's doing, and needling is so amazing. When we get a little bit of pinpoint bleeding, so we don't need a lot, we don't need like vampire facial or anything. When we perform needling on a melasma skin, what it actually does is it increases interleukin 10, which is anti-inflammatory, right? So it increases, it upregulates interleukin 10, and it downregulates MSH, melanocyte stimulating hormone. And so immediately we notice a reduction in pigmentation. The other effect that it actually has is it reduces the melanin granules. So not only the amount of melanin granules, but it will reduce the size of the melanin granules too. So you will find that when we do treatment for whether it's epidermal or dermal pigmentation with needling, you'll see an improvement. So you may need a few treatments, roughly 4 treatments. We'll wait a few weeks in between, anywhere from, depending how, we don't want to be aggressive, but say 2 to 4 weeks in between, and making sure they're using the appropriate home care in between the treatments. So needling is a non-thermal way. And the other way that is amazing is green LED. So green LED, roughly 530, 540, depending on your manufacturer. Green LED is going to reduce inflammation, which therefore reduces and inhibits the pigmentation production, and it's non-thermal. So they're great devices to help with melasma. And there's not many pico lasers around, but anyone who's got a pico, that a pico laser where it's photoacoustic and not photothermal is going to also help with melasma. Q-switch is okay. You still need to be careful. We still need to cool the skin between passes, but pico is one step better than your Q-switch laser. And then of course we've got our retin-fused cold peel. So the cold peel, being cold, is a high amount of vitamin A or retinaldehyde and niacinamide, and that is going to help with reducing melasma. So let's have a quick look at a photo of melasma. If you're on Instagram, just hop on over to Facebook and then you can have a look at my screen. Let's see if we can bring this up. Let me see if I can share my screen. Of course I can't. Oh. Came up just before for me to share my screen. Of course I'm not going to be able to. All right, so that's not going to work either. All right, never mind. So I was going to show you some photos of the symmetry of the melasma, and there's actually a patch. So there's a white patch between the pigmentation that you can see and a white faint line between the actual lip line and the melasma. And if you look closely, generally you can see there's this little sort of, white line almost occurring, and that's usually a dead giveaway. So we can actually see this line there. I'm going to try one more time to share this photo. If not, it is what it is. Gotta love technology. Oh well, never mind. I'll have to use a different program next time. All right, now let's look at ways to treat epidermal pigmentation. So with epidermal pigmentation, it's a lot more easier to be able to recognize, because generally it's not symmetrical. Freckles look like freckles. They're not big patchy patches of doesn't look like this big patch of pigmentation, and generally you can see it, and they've had a lot of sun exposure, and it's this mottled sort of look. With pigmentation that's derived from the sun, IPL all the way. So I love my IPL, so 530 nanometers, 560 will work, but 530 will pack a punch. And generally we're sort of treating with about 15 milliseconds, 15 to 20 milliseconds. And we find that basically it causes the pigmentation to desiccate, comes up to the surface, and it's on its way. So within 7 to 10 days, those little microcrusting or miloing will actually start to fall away. And the other way you can treat epidermal pigmentation is, yes, with a laser. A little bit more downtime, of course, and very hard to treat like a much bigger area, but nonetheless, you still can treat each pigmented lesion on its own. So you've got your laser, IPL. Again, you've got other peels and other treatments, other skincare type of treatments you can help with epidermal pigmentation. But one thing that I've but I've been using the last couple of years is your plasma pen. With your plasma pen, we do our spray technique. It's a very light spray. We don't spray heavily with our plasma. We find that it microcrusts, and within 7 days it falls off, and the results are amazing. I love plasma because it is colorblind. So we find with our plaque spot or our plasma pen, doesn't matter if the actual pigment is sitting right on the lip line or the hairline, or they've got a little bit of color, we can still treat pigmentation without having to worry that the surrounding tissue is going to absorb that light as well, because we're dealing with an electrical current that is colorblind. So plasma is actually amazing for pigmentation as well. So sunspots, liver spots, age spots, those type of thing. I'm trying to think. You'll get some reduction with needling, of course, but they're sort of my go-tos apart from some other peels that are on the market. Have I missed out on any other devices that are amazing for pigmentation? I think they're sort of my favorites. You could get a bit of lightening through diathermy. If you've got a diathermy machine, yes, we can remove a bit of that pigmentation as well. Again, it's colorblind, very similar to plasma in that case. So they're sort of my favorite treatment options that I'd be choosing if I was treating a pigmented skin. What else? Let's have a look. Treatment intervals will vary from device to device, but typically with pigmentation, we like to treat with thermal-based devices. It might be every 4 weeks. And in terms of treatments, you should be able to shift most epidermal pigmentation with 2 to 4 treatments if you test patch and if you're performing the right sort of setting and following proper protocol. So I understand it's hard to distinguish if you still are struggling between trying to distinguish with what is melasma and what is sun damage or epidermal pigmentation. Then feel free to hop onto our website. We have our melasma and hyperpigmentation workshop, which is recorded, and that is up on sale at the moment. And it's I think it was 4 hours where we spoke all about pigmentation, identifying it, and getting into a bit more of the nitty-gritty of treatments, combining modalities, and how to get the best out of all of your devices. Anyway, hopefully that's been really helpful and it's given you something to think about. The Apology Wet is an amazing way to help with all types of pigmentation, of course. So go onto the Apology Wet Facebook or Instagram page. There's some information there. And if not, I will see you next week on Wednesday, 7:30, same place, same channel. Tiffany, would chemical peel work too? It depends on the chemical composition, of course. And with chemical peels, you do need to be careful that we're prepping. So pre and post is going to be really important. And of course, making sure that they're doing the right thing by their skin. But it depends on the chemicals, what's in there, what the actives are, and the mechanism of action with the peels. Our Wet Infuse is amazing. I can't talk enough about it, of course, along with our vitamin A, B, and C. All right, everyone. Hopefully you're all staying warm. I will see you next Wednesday night. And yeah, have a great night. Thanks for joining me. All right, bye.